In today's video, we're going to talk about how chronic stress can contribute to chronic pain and how reducing your stress can go a long way towards helping you experience less pain. Hi, I'm Dr. Jesse Morris. I specialize in both functional medicine and chiropractic. As a chiropractor, pain is one of the main reasons people come to see me. But when helping people with pain, I think it's important to understand that pain is complex. Especially when it comes to chronic pain, there are a bunch of variables that go into whether or not we experience it or not. So it's a little different than acute pain, right? If you have an acute injury, right, you strained your knee, you stepped on a tack, there's going to be a clear signal from the body up to the brain about the injury or damage, and you're going to get an acute pain response. Chronic pain is a little different, right? So you can have injuries that are going to contribute to the chronic pain. So whatever level of tissue damage or the state of the tissue is going to contribute. And then there are your levels of inflammation, right? So the systemic level of inflammation in your body is going to contribute to how much pain you experience. Generally, the more inflammation you have, the more pain you're going to have. And inflammation can come from food reactions, from the gut, from a poor diet. There are a lot of different sources. Actually, stress can cause inflammation. So lots of different sources where inflammation can be elevated in the body. And then there's your brain's ability to actually dampen or inhibit pain, right? So there are signals that come from the body up to the brain about pain, but your brain has this amazing ability to dampen or kind of filter the pain signals. So how healthy your brain is and how well it can inhibit pain is an important factor. And then there are these emotional pieces or emotional factors. So your emotional state is a big contributor in terms of how much pain you experience. So how connected you feel socially is an important factor. And then there's stress, right? Just your general levels of stress you experience in life. So one of the leading theories around chronic pain is called the neuromatrix theory of pain. And it suggests that pain is essentially a threat detector, right? So if you have an injury, right, there's an obvious threat to your health and well-being, and you're going to be alerted about that, right? But stress, your stress response essentially evolved as a survival response, right? So threats not only to your physical body, but potential threat in your environment that you're going to have a stress response around can also contribute to ramping up your sensations of pain, right? And like I said, stress is essentially evolved as this kind of survival response, right? If you see a tiger in the bushes, right, you're going to have a stress response. And all of the activities or functions that kind of get ramped up in the body are there to help improve your probability of survival, right? So your heart rate goes up, your breathing rate goes up, pupils get big, your muscles get tense, right? You sweat, mind starts to race. So all of those things are going to help you kind of prepare you to either fight off the tiger or run for your life, right? So stress is directly linked to anything you're perceiving as a threat in your environment, right? And threats to your environment in this neuromatrix model can contribute to the brain basically producing this perception of chronic pain, right? So if you have chronic pain, you're experiencing some level of chronic pain, reducing your stress can be a really powerful way to take the edge off and reduce the amount of pain you're experiencing. But let's talk about stress reduction a little bit, right? I know it can be a little bit vague, but what does it actually mean? So here's the way I think about it, okay? When you have a stress response, you have very kind of typical activities that get ramped up in your body, right? Your heart rate goes up, your blood pressure goes up, you sweat, your mind starts to race, right? Everything gets kind of activated and ramped up. So for me, stress reduction is putting yourself in an environment or an activity that is the opposite of that stress response, right? So putting yourself in an environment where your heart rate can slow down, your muscles can relax, your mind can calm down, and your nervous system can feel safe in your environment, right? So there's lots of different methodologies, practices that can really elicit a relaxation response, right? So there's meditation, there's yoga, there's spending time in nature, spending time with loved ones, taking a nice bath, right? Many, many different things to choose from. I think the key, especially if you have chronic pain, is finding the activities that you really enjoy, right? That really work for you. The other aspect of using stress reduction to offset pain is that it has to be a pretty regular routine, right? The truth is, most of us are under a ridiculous amount of stress, and it just keeps coming, right? So having some consistency and regularity in whatever your stress reduction practices is really important to keep offsetting the effects of chronic stress, right? So stress is going to ramp the nervous system up. Having a regular practice of a way that to help your nervous system relax and calm down is really important. So if you're experiencing some level of chronic pain, I really encourage you to experiment with different stress reduction practices or activities that can really help your nervous system calm down, and find what you like and do it regularly. Listen, I hope this is helpful. I hope it's insightful. Thanks for taking a few minutes to watch this, and I look forward to seeing you soon.